Shanice Gallen, reporting live from FAMU 20 News. And today I have with me the Critical Health Society of Tallahassee. On my left, I have Ms. Ebony Little, and she'll be reporting on to you today the 9 positions of the American College of Physicians. And on my right, I have Ms. Satavia Brown. She'll be reporting on the effects of the ACA and the health disparities. And altogether, the whole Critical Health Society will be reporting on the relationship, the racial and ethnic disparities relationship. And right now, we'll get started with Ms. Little.
To begin with the 9 positions of the American College of Physicians, Position 1, providing all legal residents with affordable health insurance, is an essential part of eliminating racial and ethnic disparities in healthcare. Position 2, all patients regardless of race, ethnic origin, gender, nationality, primary language, socioeconomic status, sexual orientation, cultural backgrounds, age, disability, religion, are deserved the high quality healthcare. Position 3, as our society increasingly becomes racially and ethnically diverse, physicians and other healthcare professionals need to acknowledge the cultural, information, and linguistic needs of their patients. This is a sensitive matter and needs to be strengthened. Position 4, physicians and other healthcare professionals must be sensitive to cultural diversity among patients and recognize that preconceived perceptions of minority patients may be placed a role in their treatment and contribute to disparities in healthcare among racial and ethnic minorities. Position 5, the healthcare delivery system must be reformed to ensure that patient-centered medical care is easily accessible and physicians are entitled with the resources to deliver quality care. Position 6, a diverse healthcare workforce that is more representative of patients it serves is crucial to promote understanding among physicians and other healthcare professionals and patients, facilitate quality care, and promote equity in healthcare systems. Here are a few things for Position 6. A, education of minority students. B, medical and other healthcare professionals need to improve matriculation and graduation rates of minority students. C, medical school need to increase efforts to recruit and retain minority faculty. D, hire and promote minorities in leadership. And E, most importantly, funding. Position 7, social determinants of healthcare is a significant source of healthcare disparities among racial and ethnic minorities. Position 8, efforts must be made to reduce the effect of environmental stressors that threaten to harm the health and well-being of racial and ethnic communities. In Position 9, more research and data collection related to racial and ethnic health disparities is needed to empower stakeholders to better understand and address the problems of disparities.
And now we have Ms. Satavia Brown on the ACA disparities.
Today, I am Satavia Brown, and today I will inform you about the disparities on the ACA. Despite efforts to address the issues pertaining to racial and ethnic disparities in health and healthcare in the United States persist, disparities occur in the quality of care received, even when income, health insurance, and access to care are taken into account. Patients from racial and ethnic minorities often are far worse than their white counterpart on a range of health indicators. Some of those indicators in which are life expectancy, infant mortality, prevalence of chronic disease, and insurance coverage, among others. The Affordable Care Act includes both general and explicit provisions that could narrow these gaps. Section 4302 of the ACA requires that population surveys and federally funded health and healthcare programs enhance their collection and reporting of data on race, ethnicity, sex, primary language, disability status, those living in rural and frontier areas, and other characteristics identified by the Secretary of the Health and Human Services.
Okay, Ms. Brown, I heard you talking about disparities in your little spiel here. Could you please tell us what a health disparity is?
Yes, thank you for that question. A health disparity is dealing with the racial and ethnicity of persons who are trying to get health insurance. And right now, there's a little difficulties with them getting that health insurance, so that's where the ACA Act upon helping them out.
Okay, thank you for that. Next week, we'll have the rest of the Critical Health Society of Tallahassee reporting here from FAMU 20 News. Again, I am Shanice Gallen. Goodbye. I have with us today more representatives from the Critical Health Society of Tallahassee. On my left, I have Ms. Carla Freitas, and on my right, I have Ms. Shannon Perry. And today, they'll be discussing the access, cost, and quality of healthcare. And we'll start with Ms. Carla Frieda first.
Hello. When it comes to access, there are clear disparities in rates of health insurance coverage among Black and Latino populations. 34% of Latinos are uninsured compared to 14% of the Caucasian population. With a high percentage of uninsurance, there are consequences such as fewer preventative care services, poor health outcomes, high mortality rates, and advanced stages of illness due to lack of early detection. If health inequalities were eliminated for minorities, the total cost of medical expenses can be reduced by $1.5 trillion in a 3-year span.
And next we have Ms. Shannon Harry.
30% of direct medical costs for Blacks, Hispanics, and Asian Americans are excess costs due to health inequalities, and overall the economy loses $309 billion per year due to direct and indirect cost of disparities. As far as quality, minorities tend to experience lower quality of healthcare. According to the U.S. Health Department, Asians, African Americans, Latinos, and the poor experience worse care than Caucasian Americans.
Yes, I have a question for you. Does language barrier play a role in the quality of healthcare that Americans receive today?
Absolutely. A lot of our minorities don't speak English at home. Therefore, when they go to see a healthcare provider, their initial language might be Spanish or Creole, and they don't understand treatment methods or exactly what is going on with them health-wise. So it does play a major role.
Okay, thank you for that, Ms. Frieda.
You're welcome.
Tallahassee, and she'll be reporting on the cultural competence and humility. Go ahead, Ms. Glaze.
Thank you. In more recent news, the Joint Commission is currently working on facts about advancing effective communication and cultural competence and patient and family-centered care. Currently, and since 2007, the Joint Commission has been working toward advancing these various measures for patients at our accredited organizations through better communication, cultural competence, and patient and family-centered care. Since December of 2015, the Patient-Centered Communication Standards were approved by the Joint Commission Board of Commissioners. Currently, the standards are published in the 2015 Comprehensive Accreditation Manual for Hospitals. The official handbook at this present time can be found in the Washington, D.C. Published Library.
The Joint Commission. Ms. Glaze, can you please tell us what that is?
The Joint Commission is also known as JACO. They are the accrediting organization that oversees all healthcare organizations such as hospitals, nursing facilities, clinics, and various healthcare establishments.
Okay, I thank you for that information.
No problem.
And to sum up what the Critical Health Society of Tallahassee was saying to you today for the viewers at home, the 9 positions show what needs to be done to help with disparities in ethnic groups. Also, the 9 positions of the American College of Physicians talks about equality health care for ethnic minorities. Then with the programs such as the ACA helps diminish the disparities with ethnic groups and minorities by enhancing, collecting, and reporting all data on race, ethnicity, sex, and primary language, amongst other things. Then we discussed the relationship between access, cost, and quality, as well as cultural competency and humility. All these things help with bridging the gap of racial and ethnic health disparities. Health disparities are a sensitive matter and are in the works of being strengthened. Good evening, I'm Shanice Galling reporting to you from FAMU 20 TV. Back to you, Dr. Beck-Jones.